Hello, everyone, and welcome back. We have Jennifer Sivestri with us today. So, Jennifer, just talk to me a little bit about the 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 need, or not even really the need, but sort of, who are you actually seeing more of nowadays with the medical cannabis? We're hearing more and more talks about it, and I know, just sort of speaking on a personal level. My daughter Lily, who's 20, was really lucky to be able to have an experience with you and Dr. Amy just this week. Actually, she had a consultation with you. She is a migraine sufferer. She's a second year university student, and her migraines have kicked into high gear, along with her anxiety as well. So, sort of share with us. We're going to get Lily sort of situated and set, which is amazing. So, obviously teenagers, but maybe speak just a little bit about who's actually coming for the medical cannabis these days that you're seeing.
So, before we even get into anything further, I just want to make it clear. In Canada, we still have to be careful with minors, and
Yeah.
it's the age of 19. We do not treat anyone that's younger. So your daughter is 20, which is great. We're able to help her. The migraines, of course, like in my case, it really does. When you have proper protocol and it's guided with a doctor and an educator like myself, we're able to help with the dosing and the titration. We have so many different kinds of people coming to us from
Mm.
ages, even animals. Okay, so even fur babies. So it's really nice to be able to help all of them. And I find even the seniors, they call me with open arms. I think that stigma is starting to go away, with more education, more of these things that we can get out there to the general public, the more we bring in to help. And even just in the 2 years that I've been doing this, I think we get about 95% success rate. And again, you have to remember it's not a cure, and we are only trying to help. There's so many more tests and studies that are still being continued and will continue for many, many years. I'll be retired way long before they know everything about cannabis. But all ages. I think the most difficult age group that we have is the millennials.
Mhm.
Believe it or not, they're the ones that
Mhm.
take a lot more of our time in consultations because they are bright and brilliant. They want to just like ask a million and one questions. They have Google, right? Where our seniors,
Yes.
seniors are they rely on us more, and
Mhm.
the one-on-one consultation that we do. I really do. I'm very proud of what I do because I hold my patient's hand until they get it. Okay, until they understand it,
Mhm.
and we get the right dosing for them, and then they're well on their way, and they're feeling better in most cases, which is really nice. So you don't hear from them until they need a prescription repeat or renewal from Dr. Amy.
Mhm.
It's
Mhm.
great.
No, I love that.
Mhm.
And that was one thing, we did have another appointment set for Lily, and one thing when we spoke, Jennifer, that as a mom, for sure, I liked the fact that you said that you were available even by text message. So if she's away at school and she is concerned, that she can reach out to you, and there's definitely a peace of mind. So just one other really quick question that I had, just for clarity as well, is it covered under OHIP? Is it covered under extended health care plans? What does that look like once you've actually seen a doctor?
Yes, that's a great question. So, cannabis, every day, the insurance companies are changing, and they're
Mhm.
becoming more and more on board with covering because they're understanding that uh, these people are having huge success rates. So they no longer have to get medicated with prescription medications, where and sometimes we can actually even reduce to them down and wean them off of some medications.
Yeah.
Then they're covering the cannabis. So we have our veterans, which are, I believe now are covered 100%. We have a lot of companies that offer, $1,000 or $2,000 full coverage for a year, which is just wonderful. But to get coverage, you have to have a written prescription from a doctor. And in this case, you come through Canenta Clinic. We do the consultations. We get you all set up on a medical platform, which is virtual visit. And then you visit the doctor. The doctor consults, understands what the treatment protocol should be, writes the prescription, comes back to me. And then from there, I help guide you to picking the product line, the right dosing, and the titrating. With that comes a form that you can submit to your prescription, to your insurance company.
And does it get sent to your house? Is that
that's right? Everything
Okay.
is mailed and sent to your house,
Right.
and in the
Amazing.
package you have your product and you have your coverage for insurance. So,
Amazing.
and every day that changes. Anybody that comes into me and asks me that question, I say, call and ask first, to make sure that you have the coverage, and then I'll help you get the coverage.
Right.
Yeah, but one thing's interesting. People misunderstand the fact that they're getting a prescription. It doesn't come to them. Okay, that prescription to the licensed producer so that we can fill the prescription. Okay, you never actually see the prescription as the patient.
Got it.
Incredible. I'm glad you've had great success with CBD, Jennifer. I too have. After struggling for a year with knee pain, I got my diagnosis, and then traditional medicine didn't really offer a lot of protocols to help me. It was more topical, instant pain relief, but it wasn't anything ongoing. And then when I finally gave in and tried CBD, it was like literally a miracle. It's been, from literally not being able to stand or walk to, almost able to run with my kids. It's truly miraculous. Can you speak to some of the other types of pain relief that people are seeking out CBD for?
Oh, for sure. So we have pain for all kinds of things, pain treatments for all kinds of people. Arthritic pain, osteoarthritis. We have back surgeries, people who have knee replacements, hip replacements. These are all creators of pain, as we know. And one of the biggest things that we find in success with the cannabis treatment is inflammation. Once you reduce the inflammation in the body, that will reduce the pain right there. Okay, so we're not going to promise that it's going to eliminate the pain altogether. And if you have chronic pain where it's extremely bad at nighttime and you're not getting your good night's sleep, we then can introduce a component with a THC compound, okay, which you'll take only at bedtime, and just very small. As they say, you start low, go slow, because we don't want that high, right? But CBD on its own, for many pain sufferers, is just creating miracles out there. It's lovely to have all these people come back with positive feedback.
Yeah. Amazing. And so just very briefly before we have to take another break, you did sort of mention it. You go slow, start low and go slow. So can you just, there's a lot of misunderstanding out there. So the average person taking medical cannabis, they can go about their daily living, correct? And they're not going to necessarily be feeling not like themselves.
Absolutely. So CBD does not have, it has a 0.3 lesser component of THC. Okay, it cannot be classified as CBD without that. Okay, it's something that will help you focus through the daytime. Okay, it will help your mood, the stress. It really just makes your day so much better. Okay, without the high. Okay, because
excellent.
The component is the one that gives you the high. So you can operate vehicles, you can go driving, you can do whatever it is that you would normally. In fact, sometimes if you're in school or whatever, you might do even better.
Awesome. Well, we've got so much more to talk about, and I know that Dr. Amy will be joining us after the break, an anesthesiologist who's also practicing medical cannabis. We're going to get her take after the break, so stay with us.